was here meeting with a cardiologist, and I ended up having a heart attack. A few days later, I did a triple bypass. I got out of the hospital about 3.5 weeks later, and then I came here and I met with Joan and started with this rehab program. And it's been working out very well for me. My breathing has improved tremendously. My walking has improved. I exercise every day.
The home-based cardiac rehab program was developed for veterans that couldn't make traditional cardiac rehab. They didn't have transportation or various reasons. So this was designed so veterans could do the cardiac rehab in their own home with the support of a nurse or physical therapist. I make an initial assessment with them in my office. I explain the program to them. It's a lifestyle change. We focus on your exercise, your diet, smoking cessation, alcohol cessation, your medications. It's a holistic approach. And then I introduce the equipment to them, and then I follow up with them for 12 weeks by telephone. I go over their blood pressure, their weight, their pulse, their blood sugars, their diet. What have they done for exercise? How many steps have they taken a day? What are their barriers? How can I help them? Any chest pain or shortness of breath?
The weekly calls are very beneficial because I have a plan and goals that really allow me to focus on getting my health back on track. What I've chosen and what's been recommended by Joan has been to do as much walking as I can. I've even started playing golf.
Morning. I think that cardiac telehealth is a great help to patients in a rural setting. We have the ability to access more patients, and the home-based cardiac program can empower the patient to have them develop some sense of confidence that they can exercise, that they can overcome some of their impediments and go on and be more functional. I've been very excited about how the patients have received this program.
I get to the point where I look forward to Joan calling me on Wednesday afternoons. 3 o'clock comes, I know I got to be near the phone, get ready for a call, and then I give her all my numbers, and she'll check with me, see if I have any pain or how the week went and so forth, which I find is good.
I've had some veterans say I'm the devil on the shoulder, or others say, I'm the angel on the shoulder. I hold them accountable for their taking control of their health and making it better. I'm very proud of the veterans and their dedication to this program and to making their lives healthy. It makes me feel like I've made a difference in their life, and I'm proud of that because they've made a difference in mine.
Home-based cardiac rehab is one example of many programs the VA is invested in to ensure that veterans and their providers are connected. That technology may be as simple as a phone line between a nurse and the veteran, or as high-tech as a video conference line from a specialist in an urban facility to that rural veteran in his or her home. What matters is that our veterans and their providers are connected to get the care they need when they need it.